what makes for a long, healthy, and happy life? It turns out that the quality of our relationships plays a significant role. In fact, according to the world's longest scientific study of happiness, Harvard researchers concluded that the stronger our relationships, the more likely we are to live a happy, satisfying, and healthy life. Welcome to UT Health San Antonio Wellbeing Wisdom Podcast, a dose of learning for healthier, happier lives, brought to you by the Office of Human Resources. I am your host, Laura Gottlieb, and our topic today is relationship health. We are joined by relationship health expert, Dr. Fei-Yu Lee. Dr. Lee is a licensed clinical psychologist at the New Opportunities for Wellness Clinic in the Department of Psychiatry and Behavioral Sciences. Her clinical work centers on providing evidence-based treatments to help individuals heal from trauma, develop emotion regulation skills, and achieve life worth living goals. She is part of a highly specialized team dedicated to treating severe emotional dysregulation, including suicidality, self-injurious behaviors, and relational impairments. Welcome, Dr. Lee, and thank you for your life-saving work. We know that you're making a difference, and we're very grateful you're here with us today to share your well-being wisdom on the importance of relationship health to our overall mental, physical, and emotional well-being.
Thank you for having me. I'm excited.
We're absolutely delighted to have you here with us today, Dr. Lee. To kick things off, please tell us a little bit about your professional journey, as well as your interest and expertise in relationship health.
So I began my career working with individuals facing really serious mental illnesses. We're talking about schizophrenia spectrum disorders and severe mood disorders. A lot of my work involved providing community and home-based services to support those individuals and their families. So very early on, I realized how family systems function, and a lot of my work centered around collaborating with the family members to support individuals who are suffering from mental health problems. And through this experience, I have gained a deeper understanding of how, like I said earlier, how family systems function. If one team member is suffering, the entire team feels the impact. And in recent years, I've shifted my focus slightly to working with individuals experiencing severe emotion regulation difficulties. And think about intense mood swings, chronic impulsivity, or difficulties managing distress. I've seen firsthand how these challenges just don't affect individuals themselves, but they also affect the relationships they have. So the work I do now is working with our DBT team, provide a lot of skills training, provide one-on-one coaching services to individuals who want to build meaningful connections, develop skills to heal themselves, and repair relationships that really matter to them. So that's like a quick overview of the work I've been doing in this area.
I see this as incredibly important work, not only the relationship between a mental health challenge and the ability to connect with others and maintain healthy relationships. So thank you for doing this really, really impactful work. I'm curious, what are the dynamics of healthy versus an unhealthy relationship? What kinds of things foster healthy connection? What kinds of things get in the way?
That's such a great question. As a clinical psychologist, my knee-jerk reaction is to not categorize something as healthy versus unhealthy. But there are factors that we can consider to help us examine our relationships to see if it's at a status that we're happy with. So two big facets we're talking about here. One is stability and quality. For stability, it's pretty straightforward. I wanted to think about what you're hoping to get out of a relationship. So if you are into having exciting relationships, a lot of ups and downs, then you may go to Six Flags for an exciting roller coaster ride. And another way to see stability is to see if you are on the train with your partner, experiencing life together, heading to a destination that both of you want to be at. So there's no right or wrong way to choose stability. It's just how you feel the relationship is going across some time span. And also pay attention to patterns of rough patches. How often do you have big fights? Is it happening every 2 weeks, or you guys have difficulty navigating transitions? Let's say when you have a major move, when you have your first child. So those rough patches happen across different relationships, but the stability is something that you can think about when reflecting on how healthy your relationship is. Now, Laura, I'm curious about what you think when I said the quality of relationships can also indicate the health status of those relationships. When you hear that, what comes to mind?
Yeah, that's a great question. Thank you. When I think of quality relationships and the relationships that I have in my own life, for example, I think of those relationships that feel nourishing,
Yeah.
that help me be a better version of myself. So sometimes the relationships can be very affirming, very loving, and sometimes they can challenge me
Of course.
to try harder, to try something new, to help me lean in to maybe areas of discomfort where I can grow.
Oh, that's
So, and I think that's why I really appreciate your reframe on healthy versus unhealthy relationships, because I think we have relationships probably for different reasons. And there are some that I seek that sort of loving, affirming, nourishing connection, and then others that I want them to push and nudge me.
Yeah,
And they're not
absolutely.
necessarily the same person.
Yes, absolutely. I think you're touching on key dimensions that we consider, by we, I mean scientists, we consider to measure the quality of any given relationship. And before we talk about like more sciencey stuff, I want to say that we have this inner wisdom that can help us understand or be honest with us, with ourselves, to see if we're satisfied with our relationships, right? So satisfaction is a key factor there. Also, communication. We cannot have a healthy relationship without the foundation of healthy communication. So that's another thing. Intimacy, that's another important dimension. This includes emotional and physical closeness. There is a lot of assessment out there you can do. And this is also, this is a good time. If people are thinking about, oh, I want to find areas to improve in my relationship, rather than determining if I'm in a healthy or unhealthy relationship, I'm suggesting that those are factors that you can consider. So another one here is commitment, and trust, equity, attachment, and social support. Laura, I heard you say a lot about like social support is very meaningful to you, and the closeness that you experience in your relationship. So all of that are ways you can see your relationship and maybe see ways that you can make your relationships better.
This idea of listening to your inner wisdom, to know if the relationship is meeting your needs seems important. And then also earlier you had mentioned rough patches and maybe a pattern of that, and noticing that, and all these dimensions of relationship, everything from communication, intimacy, commitment, trust, all of these facets of a relationship that is working well, that has elements of connection. I'm wondering about those broken relationships or estrangements. What are your thoughts on that?
That's such a good question, Laura. I actually have experienced this topic in my own clinical work. So I did a quick research, and there's one study from, well, let me look up, from 2015. They interviewed over 350 people, and half of them report experiencing at least one type of estrangement from their family member. And up to 60% report that it is from one or more immediate family members. So we can see that this is so very much prevalent. It is not something that people struggle, just one or two people are struggling. This is nearly half of people who are having some severe problems that they're going through in their relationships. And when I talk about broken relationships, I also keep in mind that relationships, they change, they evolve. They're living creatures, if I may put it that way. So one moment there might be more distance, and another moment there might be more closeness. And once a relationship is broken, doesn't mean that it cannot be repaired. It doesn't mean that reconnection does not happen in the future. Is this helpful?
It's extremely helpful, because when you think about either a broken relationship or estrangement, that's a snapshot in time, and yet our lives are a moving picture. And just because something might not be working well, or there might be some division now, doesn't mean it will always be that way. There's always opportunity for repair. So I do appreciate that kind of
Absolutely.
framework and thinking about it,
Mhm.
especially if somebody's in the midst of it. And if somebody's struggling with it and needs extra help, do you have any recommendations on things that they can do?
Of course, I think therapy, I'm a therapist. I would love to recommend therapy. I think it helps anybody have clarity of what is going on in their life and to see if they would like to work on a relationship. Granted, to repair a relationship, you need two parties to be ready at the same time. It doesn't mean that personal work is a waste of time. It's always helpful to have that sense of clarity, to have the sense of confidence, knowing what is wise, thinking from your wise mind, what is wise, and how to approach a situation that's highly, highly stressful.
Mm-hmm. And I understand that your clinic, the New Opportunities for Wellness Clinic, also known as the Now Clinic, you offer couples and family counseling, for example, and so might be a resource to some of our listeners.
Absolutely.
Okay, I'm just going to share the phone number. It's area code 210-540-7222. For our employee listeners who are looking for counseling assistance, we do offer our UT Employee Assistance Program at 1-800-346-3549. So yeah, just in case anybody's struggling with that, I just wanted to make sure we share those resources. As we're talking about these issues, the expression love is more than a feeling, it's an ability comes to mind. I think I heard that quote in a movie. What can we do to strengthen our ability to demonstrate our love, affection, and care for others?
You're asking all the best questions, Laura. First thing that came to mind is extending love and compassion toward yourself. I think having a deeper understanding that we're all humans, and humans are messy, humans can be prickly, and we bump into people. We can be hurtful toward people that we most love. So having that understanding of, I am a human, my behaviors are my actions don't define who I am as a person. When you have that deeper understanding of yourself, it's easy to see other people as flawed humans as well. So practicing self-compassion, practicing validating the experiences that you have makes it much easier to see other people as reasonable people going through a tough time, maybe expressing that emotion in a way that can be hurtful. So I would say the first step is start with yourself. Just like when we're flying, people will say, put on your mask first before you take care of the person next to you. Another thing I think that might be helpful to think about is how to love better, is how to listen better and how to know the people in your life better. Deeply understand their needs, understand their attachment, understand what makes their life easier is the first step. If you're offering something the other person doesn't want, there is a mismatch, there is a disconnect. So ask them questions, be curious about what they need help with, what they feel, what actions, behaviors make them feel loved, get to know them. And so that what you're offering matches what they need from you. I also want to share a really interesting piece of research I came across lately. It's this team studied perceived partner responsiveness. When one partner perceives that their partner is responsive to their needs, it starts this upward spiral. This is the easiest way I can put it. Responsiveness begets responsiveness, and responsiveness in a relationship sets the stage for compassion, sets the stage for closeness in relationships and satisfaction in relationships. So those are the three things I want to highlight. They're not small things to ask people to do. Just three things that you can keep in mind when you're navigating different relationships in your life.
A couple of things really grabbed my attention here, and I'll start with this idea of sort of what you're offering needs to match their need. So I'm a mom. I have a blended family of 6 kids, and sometimes mothering can be smothering.
Yeah.
And the term that I would use is, it's almost, if I'm not careful, it can come across as overcare. And sometimes if we slide into overcare, and I'm imagining I'm not the only one, then sometimes that offering exceeds the need. Is that one way to look at that?
Absolutely, Laura. Actually, this reminds me of a trick I teach my patients when they express frustration of not having the connection they want with their loved ones. I teach them to use this question when their loved ones come to them. They can, or if they see their loved ones experiencing some stress, they can ask the 3H questions. Do you need me to hear you, hug you, or help you? The other person, there's so much beauty in this question. It allows the other person to self-assess, what is it that I need? And by thinking about their own need, they will be able to give them an opportunity to practice expressing their need in a very productive way. And in turn, it informs what's the best course of action other people can do for them. So the 3H's, do you need me to hear you, hug you, or help you?
Those 3H's are very powerful, especially many of us will slip into problem-solving mode with our loved ones. And sometimes what they really need is just to be heard and a hug. And so
Exactly.
clarifying those expectations up front, helps one meet those expectations. And the other thing you mentioned earlier about expectations, this sort of, I'm going to call it a bid for attention, and kind of the importance of tuning in when someone is reaching out in some way, and a failure to connect, I imagine, would reduce the quality of the relationship. But recognizing that reaching out and reaching back perhaps would foster connection.
Yes, absolutely. And another way to foster connection, I talked about responsiveness earlier, and think about a gift you can give to people around you by expressing your vulnerability. If you're expressing vulnerability to people around you, they feel like they have the permission to reach out to you when they're going through a rough time. If you're always the tough one, if you always have your stuff together, if if you're you're rocking their life, it's hard for them to feel the comfort to come to you, because they create this emotional barrier for them to reach out to you. So in addition to respond well to people who are reaching out to you, I also invite you to show some vulnerability within yourself.
Wow, I really like that. All of us probably have very good intentions for nurturing our relationships, but The reality is many of us take them for granted just due to the hectic pace of modern living. I know in my own life, my work, my family obligations can sometimes interfere with my ability to make and maintain those social connections. Do you have advice or recommendations on some efficient, effective ways we can prioritize and nurture our social connections and our relationships?
That's another good question. This is something that I think about in my clinical work as well, and in my personal life, to be honest. One of the first things that popped up for me is to watch out for loneliness. There was a study that came out early last year in 2024. They did a large scale survey. They interviewed thousands of people. And more than 10% report that they feel lonely every day. Younger people tend to be more prone to experiencing loneliness. And about a third, 1 in 3 Americans say they were lonely every day or at least several times a week. So there's no shame in feeling lonely. This is a human emotion. We're not really great at detecting loneliness. And I will tell you why this is the first tip I'm sharing. Loneliness, if people are experiencing a lot of loneliness, they're more prone to negative emotions. And it leads to emotional and social withdrawal. When they are distancing themselves, when they're isolating themselves, it leads to perceived rejection and really biased interpretation of social gestures from other people. So they don't feel safe, they don't feel connected. It causes stress. Stress leads to unhealthy coping, more isolation, and leads to diminished self-worth. So watch out for loneliness. If you have been by yourself, going to work, coming home, not talking to anybody, and get annoyed if you even see a text from someone who cares about you, pause and assess to see you've been feeling lonely, if that's the reason you're pushing other people away. So that's one thing that I always assess in my own clinical work, to hear what is behind people's anxiety, depression, to see if their loneliness plays a part in their mental health issues they're experiencing. Some other ones that can help us strengthen connection with other people. Laura, I loved how you validated the busyness of modern life. We have so many things. You're a mom of 6 kids. You're juggling so many different things at the same time. So one thing that may be feasible for people to consider is to find small pockets of time to spend with other people, just doing mundane tasks. If your friend is going to their eye doctor, to a dentist, and they have to wait in the waiting room, if you happen to be in the neighborhood, drop by, spend 10, 20 minutes, bring them a coffee, just sit around with them. If they're walking their dog, go with them. If they're driving their kids to a game, join them so you can spend some time. Finding those small pockets of time can really strengthen that closeness, because those ordinary activities provide a lot of opportunity for shared experiences. And it shows that you're actually trying to create the moments with the other person. It means a lot.
It's funny, I never really thought about it, but I often offer people rides to and from the airport. It's just neighbors,
Yes.
friends, family, whatever.
Mm-hmm.
And it didn't occur to me that that is a very simple, efficient, and effective way to nurture relationships with people, I don't see every day. And,
Exactly.
I never really thought about it, but there is some magic in talking with people in a car. People tend
Yes.
to open up, and I've had some great conversations with family, friends, neighbors, just going to and from the airport. So that's really
Absolutely.
powerful. Yeah.
Yes.
Hmm.
And one reason is it allows people to interact very organically. It creates a sense of togetherness and comfort. Think about how safe we feel inside of a small space with the other person, right? It makes total sense. Car rides create this opportunity for us to connect.
Mm-hmm.
Yeah.
Great suggestions. It seems intuitive that the healthier our relationships are, the better off we're going to be. What are some of the big benefits of having strong social connections with others?
What does it not benefit, Laura? You talked
Right.
about the research in the beginning of the podcast. The research came from Harvard, show really strong relationships creates another two H's, right? Health and happiness. There are a lot of H words here today. And it's not surprising. Good relationships, healthy relationships make us feel happier, more satisfied, make us more content. And the study that you mentioned earlier, Laura, it shows that those ties that we have in our lives, they protect us from, I guess, hardships of life. It helps to delay mental and physical decline. It's a better predictor for our health and happiness than social class, IQ, or even genes. So it's a very, very powerful tool we have in our pocket that we can actually change. There are a lot of things that we cannot change, our IQ or genetics, but relationship is something that we can modify and improve to benefit our life satisfaction. There's a lot of mental health benefits as well, physical health benefits. People who have stronger, better relationship tend to have lower risk of chronic illnesses. There's also cognitive and emotional benefits. So people who have better relationships in their lives, they have sharper cognitive function. They have better emotion regulation skills. They tend to have more supportive friends and family members that help them to process emotions constructively. So you name it, relationship is this big buffet. It offers a lot of health and health benefits to everyone.
If relationship was a pill, we'd all be taking it.
Yes, we should be taking it all together.
Yeah. Well, I have one final question for you. And you touched on it earlier when you talked about the role of self-compassion in, first you have to connect with yourself before you can connect with others. And, sometimes our biggest barrier is ourselves in terms of how we're connecting with others. So I'm wondering your thoughts about the relationship with oneself. Why does it matter?
It matters in the way that the self-perception acts as an anchor or reference point for us to see the world. We don't see the world outside of ourselves. We see that through our own eyes. We feel the world through our own senses. So if you are feeling balanced, if you are experiencing self-love and self-compassion, it's easy for you to see other people in a very balanced view. And there are different ways we can practice self-compassion. Some of the ones that people already probably know. Laura, when you think about self-compassion, self-love, what are some of the practices that you,
Yeah, you're asking me. So, for some reason, what's coming to mind is self-talk. And when I think about my relationship with myself, like on my best days, I'm my number one fan, I'm my best cheerleader, I'm my best friend. On my worst days, sometimes those little negatives can slip in, that perfectionist side where, maybe I made a mistake or misstep and I'm beating myself up. So self-talk seems to have I don't know, it just seems to have an important role in the relationship you're having with yourself.
Yes.
And, what comes to mind from that is positive affirmations. So to counter maybe any negative self-talk with something more positive seems important. So what are your thoughts on that, on self-talk as it relates to how you are connecting with yourself?
Absolutely. That's such a fantastic strategy. And I recommend it to people I see I work with in therapy as well. So self-talk reflects how we go about challenging negative beliefs. Those talks that we have, those voices we hear, are they a critic? Are they a loving but strict coach? Are they warm? Are they understanding of the difficulties that we have going on? So it's a really good self-reflection for you to think about, when do the voices show up and what are they telling you? And if they are trying to be helpful, but in a really harsh way, maybe tweak that. Understand that your self-talk is here to help you, to support you. And you have a say in how they communicate with you. If they're way harsh, you can say that's really harsh. I'm not an idiot for forgetting an appointment. I can't easily change that. It's just something I can easily make up. So pay attention to how you talk to yourself. A couple of other ones that are a little bit less obvious to people, I guess, is to take care of your body. Our emotional health hinges on how healthy we are physically. So pay attention to how you're nurturing that. I remember Laura talked about earlier, nurturing yourself is an important aspect of health, of relationship, and also how you nurture yourself, right? So there's also pursuing activities that bring a lot of joy, a lot of satisfaction, a lot of makes you feel that you're competent and capable, and also practice gratitude. How do you pat yourself on the back? I recommend this small technique to people, especially for the people who have a lot of things to manage on a daily basis, mom, a working a professional, a caretaker. I want people to go back to their to-do list and see how many things they actually checked off. So people tend to focus on what they have to do that's not completed yet. They don't give themselves credit for how much already completed. So do a mental scan maybe at the end of the day and think about how many things you actually spent time, took the effort of completing. So that's another thing that you can practice gratitude towards yourself.
You've mentioned a lot of wonderful practices that are really honoring of the self, everything from taking care of yourself physically and emotionally and expressing gratitude for accomplishment. You're right. Most people will focus on what's not been done or the gaps as opposed to what they've achieved or accomplished or, even tasks that they've checked off for the day. So really appreciate how you're pointing to the importance of a relationship with yourself and how it translates to relationship with others. You are someone I could honestly talk to all day. Dr. Lee, thank you for joining us and making lives better by sharing your well-being wisdom with us today. Tune in next time when we discuss relationship between food and your mood. Until then, take good care.
Thank you, Laura.